If you could state your name and that you're okay with being recorded.
My name is Andrea Corona, and I'm okay to be recorded.
In your opinion, what are the community's strengths?
Well, I'd say as far as strengths, speaking since I work for the Department of Public Social Services, they really are trying to make an effort in reaching out to the homeless community as well as the elderly. That's actually been a big push lately, at least in the last 2 years or so, especially with the changes in healthcare reform, that kind of thing. They're trying to advertise a lot more on radio, that kind of thing, to get people in who may not have qualified for health assistance before, whether it be food, healthcare, even for welfare cash assistance, whatever it might be. People are a little bit more, rules have become a little bit more lenient, so.
And I feel like people may not know that those changes need to be.
Right, exactly. And I think in a recent study they said that at least for the elderly community overall are the least likely to do that, but they're the ones that are a good part of what the reform has been about.
Least likely to do what?
To even bother applying for any kind of health care assistance, whatever it might be. And there's a stigma to it. That's something that the county has been trying to kind of turn around as well.
That's what you should be intended probably.
Right. And they would never think that there's anything that they could do to get that kind of help, but they're trying to advertise it a bit more to help a little bit more people, and we're trying to push for that to kind of help cover as many people as we can, at least in the community.
That's definitely a really good positive thing.
Yeah.
You said that they tried to communicate through radio.
Radio, I've heard a couple of radio advertisements. I don't see much else as far as like billboard type stuff. I don't know if that's just like a budgetary constraint or not, but they are trying to make improvements as far as making it more accessible. I think they've beefed up the online system, so you can go on the internet now and apply for it. They have been trying to put up call centers actually to also make it so people don't actually have to physically walk into an office if they don't have transportation or something. They can just go ahead and apply by phone or. So yeah, I would definitely say that they're trying to make it more accessible that way.
That's really very realistic of them to understand that not everybody really has transportation.
Exactly. And I think that as far as, they're trying to make steps towards being more accessible that way, like the call center, for instance, which I've been a part of trying to develop. We only have one in Riverside County, but there are plans to make more of them. Call centers? Yeah. So
They have these ones.
they have one, but it's a big learning curve, much like anything else in government. At least 2 more. They're trying to help service like the Hemet community out towards the desert a little bit more. Right now we only have one hub that services most of at least central Riverside County, but we're a huge county, so we cover a lot of ground. So, good stuff to come hopefully in the near future. Yeah.
And then from what you've seen, how do you feel like employment is?
It was a hit and miss. There's a lot of, I see little things, because I think I was actually on one of the billboards online, Indeed or something, to see what kind of employment opportunities there are out there. And there's some, part-time opportunities, things like that. So I think it was down for a while, but I am seeing a slow increase just with, hopefully that means, it's a sign that the economy is getting better.
Things are picking up?
A little bit.
Hopefully.
But, it makes it really hard. For instance, for myself, I'm trying to also go to school at Cal Baptist University as part of their school psychology program. A conversation that we've had a lot is in 2 years I'm going to have to do like a year-long internship, which means now I have to face possibly quitting my job to do that. And most of them are not going to be paid internships. So how do you expect a full-time working person, I'll be in my 30s by then by the time that's happening, to be able to sustain and, take care of your common needs when you're trying to have a year-long thing. Right. And then talking about, your bills still have to get paid, mortgage still has to get paid, you're still going to have a car payment, and then you're going to have loans after that, student loans. So realistically, it's kind of a hit and miss. So.
Yeah.
Yes.
like all that. Yeah.
I know. So how do you function, right? I mean,
We don't.
I have a full-time job, right? So even then, because that's something that we've also talked about, I'm also trying to possibly take on a part-time, nighttime job
Yeah.
just to try and supplement for that. So it's like, how do you balance all of that? And we don't even have kids. So when you decide to do that later on down the line, it's going to be a while.
Thinking
So
like, well, how does somebody can afford it? It's like,
when
will
we
ever
over,
really
exactly, that's the conundrum. If you find the answer to that, please let me know, because I still don't know.
I'm trying. And then do you have health care coverage?
I do.
Um,
I'm very lucky. I have it covered through my employer right now. Yeah, I hear gripes every now and again because it depends. It's just single for myself, but it's like my sister has health care coverage for her entire family, and that takes up a big bulk of her check. Yeah, we get flex benefits, that kind of thing, but those increase and fluctuate every year when we enroll. And then I always hear gripes about the increase in what you have to pay a copay just to go in to see the doctor. And then if you're there for an hour and they see you for like 5 minutes to say, oh, there's nothing we can really do, or there's nothing that,
still gotta pay.
you still got to pay, the $50 or whatever it is. So it makes it kind of tricky. But
Do you have a family doctor or a specific doctor that you see?
I do.
You don't have to say names.
No, but yeah, I do. I have a primary doctor.
How often would you say you visit the doctor's office?
Maybe once a year. Once a year. Not necessarily hard. They make it pretty easy. They do make it easily accessible, but I would say that part of the difficulty is if you're immediately sick. Like, for instance, I was dealing with, well, everybody in the house is sick, but I was debating, okay, do I either want to wait the 2.5 to 4 hours at urgent care because they don't have immediate appointments right away, or, do I want to call and then be seen in 2 weeks? By then, you may or may not be better. I don't know.
You're like, hey, emergency.
It's a gamble.
Urgent care.
Yeah,
Or
it's a gamble either way. So that's what I find myself dealing with most of the time if I feel like I really should go, but hit and miss.
in general, would you say you're satisfied with your health care coverage, or maybe there's some things that you definitely want to change?
For the most part, I want to say that I am pretty satisfied with it. I had a major surgery that I probably wouldn't have been able to afford otherwise, and it was an unexpected thing that happened out of the blue. So I am grateful for that. It's there in the emergency situations when I need it, and I don't have to worry about it in that way. So I think when all was said and done, I had to pay very minimal, which was like the doctor visit copays, and I didn't have to pay out of pocket for the thousands of dollars that it was going to cost. So I'm grateful. Yeah.
It's there for it.
It's there, exactly. So it does its job.
Yeah.
It does its job.
It's definitely something where for those families where a big portion of it is they're facing it's hard to see the benefits when it's not
Right. Right.
I understand completely.
Yeah.
And then how did you hear about whatever is going on in the community? You're like online, you see things in the public?
Well, we don't have TV anymore, which is kind of how we would have done it otherwise. And again, it was because what are you gonna primarily concentrate your money on? But sometimes I hear a lot of it either like on social media, so like Facebook, for instance. I have a lot of coworkers that live in the community, so they're normally, hey, this is what's going on type of situation. Sometimes I hear it. Right, exactly. Sometimes I hear it from my parents as well because they're avid newspaper readers and they watch the news a lot. So if anything seems particularly relevant, they'll call me up about it. And then I have a little sister who actually also lives here in Riverside, so if something's going on that she's noticed, she might give me a call or tell me what's going on. So
Well, from your experience, what would you say the majority of homeless people fit under as a demographic? Not just like racially, but gender, age?
I want to say I've primarily seen a lot more males than females for the most part. I think maybe in the last 5 years that I can think of, I may have seen, yeah, you can. Yes, yeah, I think please do. Maybe the last 5 years, I maybe have only seen there's this one lady that used to come to our, she would tag team with the other panhandler that was there. I haven't seen her in a while. And then maybe in Corona 1 year, I saw a lady with a baby trying to panhandle. So I mean, most of the time I've seen
It's interesting to think too about what that says about us as a society. Because I won't see them being the ones panhandling, but they'll be like just across the corner waiting for the guy, and I wonder what that says about us, that we're more likely, presumably, I mean,
to give more to
they haven't done market surveys, but they clearly think that the male will draw more pity somehow. But I wonder what that.
Well, no, I wouldn't say that was the case, because I mean, you think if I see a lady with a baby and she,
well, then why isn't she the one with the sign? Why is she the one?
Yeah, that's true.
I've seen like a few reputation. I've always felt like almost like a sense of like anger towards
Yeah.
the woman.
If you're doing that on purpose,
Yeah,
you're
yeah.
exploiting your child.
Your child.
There's that
So
too.
I'm not gonna make
That's
it
true.
That's
true too.
Yeah.
And that's hard to do. And then knowing, are they going to be using that for the right reasons? I mean, sometimes we'll get them at the gas station, right? They'll just kind of walk in and...
I'll get them like a 20 and just put it in the pump.
Oh, yeah, and they'll put it in the pump, so if someone's actually asking for gas money, that's how they'll do that, to make sure that they're not going to go to the liquor store and buy some booze or something, right? So, yeah, smart way to do it.
And then what would you consider is the biggest health problem for the entire public of Riverside? What do you see the most of?
I probably want to say I've seen in health problems, is what I would say. I've seen a lot of drug use here.
Any particular drug or just drug use in general?
I mean, I've seen drug use in general. Like, you know, my brother, for instance, he's been dealing with that sort of thing as well. At least he was in his younger years, and he's not that
like prescription drugs.
Prescription drugs as well. Grappling with that, but just I've seen a lot of just at least coming from the welfare office perspective, you see people who are obviously on something or high on something, you know, needle marks, that kind of thing that they try to cover up, but also they're bringing in kids, and that turns into, you know, a report, you know, child protective services. So yeah, so very strange things, but that was more in like, well, you know, I've seen it here, but in the Paris community as well. And, you know, just even within the homeless that we've seen, sometimes you could tell that they're not all there.
There's definitely mental health problems.
Mental health, definitely. And I think that has probably a large amount to do with that as well. I would say mental health is probably a big one. We seem very untrusting, you know, of each other sometimes, depending on which areas in Riverside that you go to. You find yourself on high alert for maybe no apparent reason, but it's just a feeling that you get. You know, versus downtown Riverside. So it's just...
Depends on the location.
It depends on the location. It depends on, you know, what you see. But I mean, I can tell you that there's at least two people that I've seen, at least when I go to work every morning, where he's a homeless guy, but he's sitting there and he's just yelling at the cars for no apparent reason. And he'll go walk like in the middle of the road right before the light turns green. And you can tell that he's mentally disturbed, but you can't, I mean, you call the cops and then what? I mean,
5150.
Exactly. So I would definitely say that is probably something that we should do a little bit more about, or at least advocate a little bit more. Yeah.
You got a lot of information.
You're welcome.